Good morning, everybody. Hi, how are you? Hey, Eugene, can you tell me you can hear me loudly and clear? Okay, great. I see you guys are all in your Facebook. That's wonderful. Okay, great. Hey, I just want let you know that why I want to create this important webinar, because we all are around that kind of age. And to be honest, my mom actually died of a stroke, and that was really sad. And I have a lot of friends actually died or disabled by stroke. And many of these people are actually, they're diabetic, and they had some kind of health problem. However, with that, I start realizing, wow, that's a big issue. A lot of people don't got to the hospital early enough. And so that will be real detrimental to many of my friends, why they got really very tough recovery because of the slow going to the hospital. So I thought today this webinar will be so important for all my friends, for everybody, all of my clients. Matter of fact, this is going to be maybe a webinar that will help you to become so helpful to help all these friends that recognize what is a stroke. So that way you can go to the hospital early. To me, that is probably one of the most best thing you do, because if you did not go to the hospital early, which might be a real issue. Give you one example. One elderly client of mine, the problem is he has started a stroke symptom. But the family thought that, well, maybe I'll take him to the doctors. And within that couple hours, he was struggling, body getting weaker and weaker and so forth. And by the time you get to the doctors, is already 2 hours, 3 hours past. And so when you get to the doctor say, hey, you got to go to the hospital right away. The sad part is with that, things are getting delayed, and the damage to the brain become a lot more compared with other people, if they can go to hospital early. So your time is so important. So just want to let you know, this is the typical problem, that when you have stroke, you don't go to the doctor office, you go to hospital. 各位朋友，我係 Andrew Lau Lowsutea Professor， 你好，今日好開心啦，有好多朋友嚟啦，有香港啦、馬來西亞啦、新加坡啦、菲律賓啦，不同人士，仲有美國啦，有加州啦，有呢個夏威夷啦。咁但係其實點解我今日咧係會講呢個topic 咧？個原因咧就係有好多人咧其實都真係會係喺中風嘅時候咧。未必知道呢個係中風嘅問題，睇唔到中風嘅風險，咁變咗嚟講咧，佢冇去到醫院啦，或者冇去到其他嘅即係好急切嘅即係 emergency 啊，或者係緊急服務嘅醫院地方咧，咁佢係做唔到了解呢個中風呢個問題住嘅。咁我話俾你，我有個朋友咧就係70幾歲啊，咁佢屋企人就尤其是個工人都唔知佢係中風嘅，咁佢開始有啲即係 weakness 一笪地方啦，咁但係 by the time 佢去到即係醫生嗰度咧，3個幾鐘頭啊，咁變咗嚟講咧，個時間 delay 咗一段好長時間，但係 after 咧最弊咧嗰個即係個腦嘅損壞係更加大咗啊！咁所以變咗嚟講咧，咁變咗損壞更加大，即係你又唔行得翻咯，或者係個 recovery 好耐咯，咁呢個咧係一個十分大嘅問題。所以今日嘅 webinar 係十分好嘅，係幫助你去了解咩嘢叫中風，尤其是糖尿患病者，一個係最多人會有potential 嘅中風嘅風險。所以呢方面咧，我都希望咧，大家朋友咧係注重下。咁能夠知道乜嘢叫中風，唔係淨係你嘅親戚朋友，可能即係你嘅側邊嘅家人啦。因為我哋大家都老啦，即係60零歲以上咧，就係一個高風險嘅地方嚟嘅。So today my webinar is so important because As I mentioned, we all around the age group. We are an age group of 60 and above, and the risk of stroke is very high, especially if we have diabetes. The risk of stroke is even higher, and so really got to understand what is the sign and symptoms. So net result, you can actually get early treatment is so important. So that's exactly what I'm trying to address today. So anyway, I'm gonna start sharing my slide. OK， 各位同學，多謝你唔好意思啊，頭先有少少嘅 technical issue 咧，咁我嘅後威朋友咧就係Eugene咧好幫手啦。So thanks Eugene, you are always a tramp for us to get me to understand what to do next step. Sorry about that. That was really good. Thank you again. Anyway, today basically my topic is very simple. If you have consistent pertaining, really you have a diabetes. Might not be necessarily really just diabetes, because I know there's a lot of people might not necessarily just diabetes, but their blood sugar can be very high, can be also besides high blood sugar, high blood pressure, and they have not even identified sometimes being a diabetes. They also have the potential risk. So that's why I thought, wow, this is such a big topic, which really we need to talk more about it. So that's why I want to develop this lecture to allow people to really understand better. Now, 今日我嘅 topic 係真係好好嘅，對各位堂友咧都有一個好大嘅幫助，知點解啦？咁但係我俾5分鐘我去解釋下我哋啲新朋友入嚟咧，因為今日有好多朋友喺不同嘅地方，馬來西亞嗰啲地方咧都嚟咗，咁所以我哋一定要知道咧佢哋現在嘅咩即係要 catch up 一啲咩叫糖尿病啦。You remember, as I mentioned, diabetes is always don't get well, you only can control. And your control, you have to drop your A1C from whatever level, drop down to below 6.4, and best even get down to 5.7. So that is something that you gotta do. And then pre-diabetic is the same issue. You have to do, if you are 6.4 in below 6.4 is because you're pre-diabetic, but you still continue to drive your blood sugar down. And then to do that, you have to control your food intake, exercise, and weight management. Plus, you can eat white food and soda and juice. Certainly, Lowsutea definitely help you to lower your blood sugar. And so the fourth stage of diabetes formation is one, your cholesterol. You're gonna have first, your cholesterol will go up. And then would damage your B cells, so the cholesterol doesn't take the B cell doesn't take the sugar into the cells. So as time goes on, you will continue more and more insulin resistance. With that, your sugar and cholesterol mixed together, your blood becomes very thick. So LDL cholesterol, you always have to watch. And with that, then your whole body, the whole entire body, all the vessels will form plaque. In turn, the second stage, your blood pressure goes up. And the third stage, if you do not continue to change your lifestyle, your blood sugar will continue goes up. Your A1C will continue really go up to all the way to over from 5.7 all the way to 6.4. After over 6.4, you are diabetes already. So the fourth stage is always the same. A lot of people actually, I just gave a seminar in Lions Club. There's 300 some people attend. And a lot of people didn't understand that either. So I thought this is really good way to explain how your diabetes is going to form, why the whole body will become formed with all the plugs or the plaques is because the cholesterol and your sugar will make the blood become thick. That's why it forms plaque everywhere. So that is our concept. We should actually continue to spread. So people say, wow, that is something very important. 各位朋友，好重要，點解 keep 講呢4段曲咧？個原因第一就係你嘅 LDL cholesterol 再加你嘅糖咧，係會損壞你個胰島素嘅 B cell。如果個 B cell 壞咗之後咧，咁佢就唔帶啲糖入去嗰個細胞裏邊，咁越整越多咧，個 B cell 出嚟都唔 work 嘅，咁就變咗好多 insulin resistance 咧。但係個大問題咧就係你胰島唔係你嘅糖再加埋你個 LDL cholesterol 啲血咧，變咁就好厚啦，好厚就放咗好多硬塊啦，咁就塞晒全身嘅血管。所以今次咧，我喺師會講一個題目嘅時候咧，好多人就哇原來咁，所以我每個全身都會有嗰啲血管塞晒，就係咁嘅原因。 咁因為咁嘅情況下咧，你血壓就會第二段咧，血壓會上翻嚟。第三段咧，你繼續唔做嘢咧，你嘅血糖開始慢慢上去啦。咁你嘅 A1C 咧就變咗係由5.7呢度直到上6.4，過咗6.4咧，第二個 stage 咧你就係糖尿病者啦。咁呢個咧係一個好重點。點解我哋而家係講全身嘅身體嗰個血管都係 plug 晒咧？就係因為你嘅 LDL 加埋糖係好厚，咁你 plug 晒成身嘅血管咧，所以嘅即係糖尿病係一個嚴重嘅問題，係一個 concept 嚟過呢次。So keep that in mind. Make sure that you remember, your blood sugar and your cholesterol it become thick in your blood and going to spread entire body forming plaque. That's the reason why you have a serious problem with diabetes, and that will damage every single organs. Okay. So why people drink Lowsutea? Because the one is that the guava leaves actually block sugar into vessels, and then the bitter melon actually takes sugar into the cells. And on top of that, you also take the cholesterol, salt, and also urine, salt, cholesterol, and sugar out of the urine, so your blood sugar continue to drop down. Now, a lot of people actually took a lot of medication, but somehow, because of insulin resistance is so high, they need something booster, and somehow bitter melon provide them like an insulin, take them to the cell, and that's why sugar start coming down. So that's real nice. 嗱，各位朋友，點解好多時咧就係飲咗退糖茶？好多人話：哇，食咗好多日嗰啲血糖都唔跌落嚟咧，因為咧喺苦瓜咧係有一個功效咧，就係好似胰島素一樣，帶啲糖咧入去個細胞度。咁你啲糖走咗細胞，你糖跌低啦。但係仲有一樣好事咧，就係原來咧。苦瓜咧係仲有一樣嘢係帶啲糖，帶啲cholesterol， 即係你嘅膽固醇啦，同埋你嘅鹽啦，喺個尿嗰度掉出嚟。咁當你掉出嚟嘅時候咧，最後咧因為你冇咗鹽咧，你血壓都降低嘅。咁所以面咧即係喺個苦瓜係一個十分好作用。仲有咧，你個番薯咧係 block 啲糖入去個血管裏邊，咁變咗少糖喺血管裏邊，咁你更加正啦。So it's so important to why Lowsutea work is because the guava leaf will block the sugar into the vessels, and bitter melon take sugar into the cells like an insulin. Plus it dump up through sugar into urine. So really a wonderful system to work, yeah? And then the thing is very important. You got to remember, if you are diabetes, some of the stroke that you're going to face is like stroke, which is the first thing we talk about. That's why I want to talk about today. Stroke, because we haven't talked about what is stroke, so you get some idea. Secondly, you have a cataract, you have pancreas malfunction, so a lot of insulin come out, doesn't work. The more important, as we move on, maybe we have a lecture later on, talk a little bit more about heart, because 40-60% of diabetes patients have heart disease, and that will be end up a heart attack or the vessel block all the coronary arteries. So you have a big issue in here. So this is something you really have to work on. Plus nerve damage. We talked a lot about few lectures earlier. The nerve damage is caused by dementia, now the Alzheimer's disease, and the high blood pressure. Again, we'll talk about that, and that will be important with damage of vessels, and plus high blood pressure will constitute your risk of stroke. And then certainly amputation, a lot of people understand what amputation is about. The wound don't get healed, they have to chop at your foot. And then diabetic nephropathy, meaning that it damages your kidney, and your kidney is so bad that you have to end up to go to dialysis, either CAPD or hemodialysis. And 30% of the patient does not have sex function, sexual function. So because of the nerve damage, that's really sad. Plus, if your pregnancy have systems such a problem like just say diabetic, future your diabetes chances are much higher. So this is something you have to really watch. Okay， 嗱，各位朋友記住，點解今日講中風嘅風險咧？因為呢個就係第一嘅風險喺糖尿病裏邊發生嘅。第二樣嘢咧就係你個眼咧青光眼啦、白內障啦，同埋胰島素壞你個胰臟壞啦，咁呢啲係全部都係有嗰個問題嘅。咁但係咧，40至60% 嘅糖尿病病者有可能有心臟病嘅問題喎。咁有幾堂我講咗啦，有不同嘅神經系統損毀啊，你唔記得嘢啊，有 Alzheimer's disease 呢啲全部講過嘅。 咁但係呢個咧亦都係糖尿病一個多人有嘅東西。咁高血壓咧亦都係個個糖尿病都多數有㗎啦。咁但係呢個咧就令到你咩有中風風險啊，所以今日講呢樣嘢一定要知道。咁啊即係斬咗腳嗰啲咧就好多人都知啦。咁就一定因為點解冇咗佢啲血唔去到嗰度咧，你好嗰啲細胞好難好啊，咁啊壞咧，咁就要斬咗腳。咁同埋咧仲有糖尿病咧，好多係有呢個腎病嘅問題，因為佢糖尿係損壞咗個腎，咁你 end up 就要洗腎啦。咁包括30個病人咧都有呢個糖尿咧係性功能冇咗嘅，同埋如果你係懷孕嘅人咧，佢多數咧係會將來亦都會有變咗糖尿病，所以呢啲就係所有我哋嘅糖尿病患症狀嘅併發症係會有喺度嘅。所以今日咧講呢個 stroke 咧係對十分係啱嘅嚇。And our company is very simple. We basically help the elevated blood sugar people to basically if they're pre-diabetic, we hope that all the things we teach you, you can prevent your or postpone your conversion to be a diabetes. If you're already diabetic, we'll make sure that you are continue to understand what to do and delay a diabetic complication. And we certainly have the 5 program. You basically have a low diet program, low fat program, how to eat, and also drink Lowsutea will definitely help you lower your blood sugar and cholesterol. And on top of that, you need exercise, weight control, and we have all these things to teach you how to do that, plus our ongoing webinar. And then you have to daily track your blood sugar so you know where you're at, because blood is the only way you can know how you're doing. And then with that, we hope that whatever A1C you have, drop it down to 5.7. That's our goal. 嗱，各位朋友，我哋其實好簡單嘅，我哋公司咧就唔係想買啲茶俾你，但係希望俾一個規格俾你，能夠你知道點去防禦你嘅糖尿病。咁點去防禦你糖尿病咧？好簡單，就係第一點防禦糖尿病嘅時候咧，就係你如果係前期患病嘅，你唔會變咗糖尿患病者。糖尿患病者咧，你就唔會變更加差嘅糖尿病。咁變咗嚟講咧，喺呢度咧仲有5個節目咧係幫助你做呢樣嘢。第一，你個 diet 方面啦，即係食材方面啦。飲嘢啊，同埋你個要做啲低碳水化合物啦，同埋飲去糖茶啦，點去做運動啦，仲有咧就係點能夠控制磅數啦，你嘅重磅啊，身體嘅磅數啦，同埋聽我哋講書啦，同埋仲有點去 track 點樣嚟睇你嘅血糖，因為只有血糖先知道你自己係點樣嘅。由 A1C 10% 或者以上嘅都可能嘅掂，即係我好多病人已經係咁噶啦。So it's very important, really good that we found so many people actually really achieving this goal with the A1C drop all the way down to 6 and 6.4. Even as of today, quite a few number of people actually in our group already reached this A1C from dropping down below 6.4. So wow, that's really good. And I see in my own eye now, I have patients that drop the A1C is 5.2. But on the hand, they are very well controlled. They do all the things we said they're going to do. They do exercise, they drink Lowsutea, they actually walk every day. They diet is very well controlled, and the weight is well controlled. And so they always track the blood exactly what they have, and they have goals so they don't give up. Man, that's really, I tell you, those guys are very, very good. They are really my model patient. Okay, so today we will talk a lot about now how high blood sugar people, which is like pre-diabetic, diabetic, can actually lead you become a stroke victim or a high risk of stroke. So this is something that you really have to do to make sure that you have understand what is the sign and symptom of the stroke, so you can actually prevent yourself end up become a stroke victim. That is so important. Okay. Now, as you know, when you have high blood sugar, you will always have one more thing that will come along, is really high blood pressure always come along. And if the blood sugar block up all the vessels, it will also block up your brain vessels, especially the micro vessels that will block. So net result, your stroke are much in a higher risk. And when you have stroke, this is a absolutely medical emergency, which you need to have medical treatment right away, because you don't get proper treatment, your risk of brain damage are continually high. even though the further complication, recovery will be much longer or even death. Now, so this webinar will give you all the signs and symptoms of stroke and what different type of stroke. So at least you recognize, so when you have stroke or you think you have stroke, you better go to emergency, meaning going to ER room to seek help. Don't go to a doctor's office or don't wait because that would not help you. I will tell you a couple of friends of mine had this issue and they wait. And the problem with that is just one more hour and further damage the brain and they recover much longer. So you got to keep that in mind. It doesn't want you to, wait to seek for medical treatment. Okay? 嗱，各位堂友，記住咧，我哋今日講嘅節目咧係好重要嘅。點解我今日特別同你講呢樣嘢嘅原因咧，就係因為第一，因為咧我哋各位堂友咧，第一嗰啲糖咧同埋加你cholesterol 加上去咧就係塞咗，記唔記得頭先講啊？塞咗好多不同嘅血管喺個腦嗰度，亦都好多微絲血管咧係可以塞到嘅。塞咗之後咧，當你真係忽然間嗰度係塞咗之後，你有個 stroke 嘅時候咧，你就要即刻要去邊度啊？去 emergency、去 casualty、去急症室，唔係話我話等下去睇醫生啦，唔好等去睇醫生，因為睇醫生係唔會幫到你嘅。仲有，如果你係有依樣嘢嘅時候咧，你個腦繼續係攞唔到啲血嘅氧咧，個腦個 damage 咧係會越整越大 ，eventually 咧嗰個損壞更加多。咁同埋損壞更加多嘅時候咧，你個 recovery 一定好長，同埋咧就可能有死亡同埋好多不同 complication 啦。所以咧今日希望咧我哋做咗呢樣之後，你有呢個 idea 咧，一 recognize 呢啲咁嘅症狀咧，你就可以能夠去呢個急症室去求醫，唔係去醫生嘅office 啊。佢哋記住呢樣嘢，一定去急症室。So, today is such an important webinar. That's why we have to identify or give you what is a stroke. Okay, a lot of people don't know what is stroke because people heard about stroke, but do they really know the sign and symptom? Majority of them, I noticed, they don't really know what is the sign and symptom. They just say, oh, I'm feeling a little weak. So I want to make sure today you have a very good, absolutely good basic knowledge of stroke so you can able to handle what is stroke all about. Now, a stroke is usually happen is when the vessels of your brain is actually suddenly burst and blood start leaking out to the brain. Or there's certain thing like a lot of diabetes will have, the vessel become very blocked with all the blood sugar, cholesterol, and the blood cannot go through anymore. So when you block, cannot go through, all the thing on the other end of the brain is going to die. And then that result, you will have a stroke that, certain function of that brain will not work anymore. So if you don't give that treatment very quick, get the brain food energy or the vessel the blood go through, you will have less brain damage if you get that blood going through. If not, the brain cells die, and then you result a very serious health issue and eventually have a lot of disability and even potentially death. So stroke symptoms occur, and usually once it happens, go to emergency, ambulance, hospital as soon as possible, not go to hospital. 嗱，今日講多啲點解咩叫中風咧？好多人以為中風就係我個手係好軟啊，但係未必知道乜嘢嘅中風嘅危險喎。有兩個最大中風嘅危險咧，第一就係你個血管忽然間爆咗出嚟，咁啲血就猛嘅流喺個腦裏邊。個問題喺個腦裏流血咧係好大件事嘅，因為你冇辦法，好似話我隔咗隻手撳住佢唔好流血得啦，一路冇得撳嘅喎，咁點算啊？一路係咁流出嚟咧，就個腦咧就 feel 好多壓力咧。咁你個腦就喺度越整越壞咧，就死嘅 ，OK？ 咁第二樣嘢好多時咧就糖尿患病者就好多咧喺個血管裏邊咧就塞，咁啲血流唔到去嘅時候，腦喺後邊嗰啲細胞就可以壞啦。咁你去唔到嘅時候咧，你最快就要快去醫院咧，有藥俾你食，或者點樣能夠俾到佢啲血能夠滲翻去個腦嘅細胞。咁如果唔係咧，個腦嘅細胞會死咗之後咧，你就嗰度唔 work 噶咯喎，唔 work 嘅時候咧就弊啦，咁就有好大嘅 即係醫療嘅問題啦，同埋你 recovery 整都好難 recover 啦，或者真係行唔到啦，呢啲嘢全部係會 occur 嘅，即係會發生嘅。所以如果你係真係有呢個中風嘅話咧，你要盡快去邊度啊？去急症室，唔係醫生嘅 office， 叫十字車盡快送你去，唔係話準備搭的士搭巴士，冇呢樣嘢，即刻叫十字車帶你去醫院，呢個係最重要嘅。So remember, if symptoms occur, make sure take ambulance to hospital, not doctor office. So, So what is the sign and symptom of stroke? And typically, this is something that a lot of people don't know. And I like to go through this very one item at item, so you know what is the sign of stroke. Now, one of the very common stroke, and a lot of people know, my body become weak. But the thing is, a lot of time is not only weak because they become numbness, they can be paralyzed and walk, the arm doesn't work. One side, especially one side arm. That's why in stroke, a lot of time you have to ask the person to squeeze both of your hands. Squeezing both of your hands, if one side is weaker than the other, so you know that is some issue there. And on top of that, a lot of people who have stroke also are paralyzed of one side of the face. So one side of the face started to drop. A lot of time also you can ask them and say, hey, raise your arm. And you start feeling that one arm will start dropping and dropping. That's when you also become one-sided, and so you can determine what's happening. So these are some of the early signs of symptoms: numbness, paralyzed in one place, weakening of the body. Now, a lot of people recognize their stroke. They say, my body become weak. Now, a lot of people recognize that, but they didn't know if I can paralyze or numbness on one side, how to identify that. That is something important. On top of that, a lot of these people cannot talk. Suddenly they become very troublesome saying things, they can't understand it, or the speech becomes slur. And some people actually cannot see. They say, hey, one side has become darkened or black or blur. And they also have some of these, as for the older folks, swallowing become an issue. They can't swallow, they start choking. Or some people get severe headache, and some of them even get vomiting and dizziness, and then they become unconscious, or they can trouble walking, losing the balance, and lost coordination. All these are the actual stroke, symptom. Now, vomiting is because of the fact that the brain, your pressure of the brain is start swelling up, and that usually are projecting vomiting, and that is something another very important sign, especially people. Actually, a lot of kids fall down even, or adult fall down, hurt his brain, bang, and a lot of time they start forming a burst of vessels, and they pressure the brain, and that result you got projected vomiting. And so when I worked in ICU, as you know, I'm an ICU nurse, I saw all that cases, and I said, man, people just need to understand. They are coming maybe just 1 hour early or 30 minutes earlier, it would be so different case. So this is something that I really want you guys to keep that in mind, the sign and symptom. 嗱，各位堂友，中風咧係一個嚴重嘅醫療嘅問題嘅，所以好多人咧就有忽然間話身體，我手臂唔喐喎，喐唔到啊，有麻痹喎，或者我冇力喎。嗱，好重要咧，你係捉住個人嘅手，兩隻手一齊撳，揸住佢嚟撳。咁你係咪左手右手係有少唔同嘅力度咧？咁呢個係第一個好重要嘅睇法。第二樣嘢，好多時咧，你忽然間係嗰個人咧，會依邊嘅冇咗感覺咧，佢跌咗落嚟咁嘅。咁變咗嚟講，佢即係醫部咧，可以隻手咧係變咗冇咗隻肌肉冇咗嘅用途咁樣嘅，咁又講唔到嘢喎。咁同埋咧，佢亦都可能忽然間唔知點講嘢，講唔出嚟嘅。咁同埋咧，仲有咧眼或者忽然間會見到黑晒一邊，多數一邊唔會兩隻眼，但係多數咧係一邊開始 ，and then eventually可以兩隻眼啦。咁同埋有啲陣時咧又吞唔到嘢喎。嗱，老人家好多係有呢個吞唔到嘢嘅，同埋頭痛啦，同埋嘔出嚟嘅東西啦，頭暈啦，有陣時淨失咗知覺啦。 咁仲有咧係唔識行啦，開始 lost 個 balance， 要坐喺度佢都好似亂晒咁走唔到。咁所以其實咧依樣嘢咧就係最 early sign 嘅 symptom。嗱，如果當你睇呢個咧，就快脆即刻咧帶個人咧係去急症室，呢個係好重要嘅。咁我喺做 ICU nurse 嘅時候咧，我係見過晒呢啲情況。咁我就希望咧，如果我啲堂友咧係有任何呢咁嘅即刻去咧，咁咧其實我嗰陣見到咧，如果佢係少半個鐘頭，即係早半個鐘頭入邊咧，佢已經係好咗好多啊。但係好多時咧，因為情況就係唔識有呢個有去即刻去睇醫生，或者要去揾醫療人士去幫佢手咧，所以咧就 end up 就個身體損壞好大啦。嗱，咁其實咧好重要咧，有3樣嘢記住要睇，最容易 identify 嘅3個啊。So it's so important. The 3 major signs you always can check is 1 is the face of the person. One side drop down. You can see this guy, the face over here, it dropped down. It always start dropping down and start drooling. Your saliva drooling out. So this is a very, very common sign for people who have stroke. There's only one side, face drop, okay? And that is some item that you can see, and right away you can say, wow, this guy has a stroke. Gotta go hospital right away. Now, and I said, one of the very early signs is you grab both hands, tell them to squeeze the arm, and you say, hey, one side weaker than the other. And you raise the arm, one side start dropping down. So all these are the very easy identifiable signs. And one arm become weaker than the other or getting numb on the other. And this is very, very early sign and easy to identify. And these 3 things, the reason why I raised it up is because so you can remember these 3 things. You can remember so you can able to find out what to do. The 3rd thing is speech. Now, when you have slurred speech, you tell them to repeat a sentence. For example, you say, have you eaten dinner yet? He will give you a sentence. He can't speak it. He doesn't understand it. He is not like that. So the speech can be very simple, but he cannot get the phrase out, and he has the slurring of speech. This is the 3 major things: the face, arm, and speech. That is something that you can very quickly identify this guy has a potential stroke symptom coming along the side. 嗱，各位朋友，其實今日咧，我教你3樣嘢去睇咧，因為頭先講到好多嘢啦。但係呢個3樣嘢咧，大多數咧好快脆咧幫助你係已經話俾你，哇！呢個係個中風嘅情況出嚟。第一，個人嘅面咧，忽然間呢度咧就變咗歪咗嚟嘅時候係多數一邊嘅，唔會兩邊嘅。好似個男士咁樣啦，個口就會歪左口嘅話跌咗嚟咁啦，咁就開始漏口水啊。咁呢個咧係一個係好快脆睇到嘅東西，因為你即刻變到佢不嬲係咁樣樣，而家忽然間變咗咁咧，咁你知道就好快脆呢個係 stroke victim 啦。第2樣嘢，你嘅手要撳下兩隻手嘅時候咧，兩手一隻手係 weak 過係弱過第2隻手咧，咁呢個亦都係一個好容易見到嘅東西。第3，你叫佢遞嗰隻手咧，佢嘅手慢慢跌咗嚟咧，咁呢個亦都知道，哇！呢個唔係好掂喎，真係佢有 stroke 噶啦。第3個咧就係個言語方面啦，你叫佢 repeat 一樣嘢，食咗飯未啊？佢講唔到嘅，同埋咧佢講嘢咧係會講啲咩東西出嚟，所以呢個咧係會容易睇到佢哋嘅 sign。所以如果嗰啲咁嘅症狀出現咧，你即刻咧就要快去咧係要睇去急症室，唔係就咁去醫務所，醫務所未必幫到你啊，要叫10字車去急症室，同埋咧仲要咧越等得耐咧，你越情況去損壞你嘅腦咧係越高嘅，同埋你個damage 係越大嘅，所以呢個係要盡快去做。OK， so you got to understand when you have this occur, the face, arm, and speech, that you can very easily identify. The next thing you know, you're going to do, you're going to be quickly and start getting yourself go to emergency, get treatment right away. 一見到呢個3個咧，就唔該你個個咧就快去咧去睇呢個去急症室去求醫啊。OK， now so I put down here time and brain damage. OK, it's so important. Time and brain damage is something that you really have to watch. the time, if you're more than 3 hours, the chances of recovery are getting less and less and less. So every second count, because brain cell will die within minutes, have no blood going through there, and they have no oxygen there. The brain, for example, if this is stuck here, out at the back, have no more oxygen, no food, your brain at the back will die. And then, wow, you have lost your capability to speak, you get lost your ability to walk. Imagine that. You don't want to do that, man. So once the brain die, is not going to work. Your body part is not going to work. For example, if my left brain are damaged and my right, anything on the right side, I can't function anymore. So this is how it works. So the stroke is so important that you must get treatment immediately as soon as you can. And matter of fact, by the way, stroke is one of the top causes of long-term disability. So in other words, you see all the people walk around with a crane, they drag the foot because of stroke. You know, they have long time to recover, or they will never recover. So don't put yourself in their shoes, or don't put your relative in their shoes. Get them treatment right away. 嗱，記住朋友，如果你係真係有中風嘅時間同埋個腦損壞，就係個兩方面咧，係盡快俾少嘅時間去到醫院，俾你能夠個腦損壞越整越低嘅，係每一秒都卡嚇。因為如果你個腦啲血去唔到，後邊嗰啲東西，你個腦嘅後邊咧壞咗咧，咁啊弊家伙啦，你就唔會識講嘢啊嗰啲東西 ，OK？ 咁個問題咧越長咧，你就越多損壞。咁你變咗咧，因為個腦損壞咗之後咧，你其他嘅 body part 咧就唔識喐㗎啦。咁唔識喐嘅話咧，咁你個情況下咧就有一個好長遠嘅復原啦，同埋或者係長遠嘅殘廢啊。因為壞咗之後佢翻唔到轉頭嘅時候，你就唔喐㗎咯喎。咁呢樣嘢係一個好多錢要同你去做不同嘅物理治療啊，或者永遠都做唔到物理治療啊，個 care 又好耐啊，你行唔到啊，哇！你個 suffering 真係好大。所以今個 lecture 咧，真係希望咧大家知道咧，就盡快去醫啊，記住 ，OK？ So usually when you stroke, what did the doctor do for you? Now that's the reason why when you go to the doctor, in the doctor office cannot help you because they have to very quickly identify what happened to your brain. And that will be the only way you can get that is you go to emergency, go to the hospital in order for you to get that kind of treatment. Like for example, they have to do a CT scan on you, they can do an MRI on you, or they even do an ultrasound, EKG, EEC. All that are supposed to do the hospital. Because in doctor office, they don't have all the equipment. That's the reason why it's so important. You got to go to that doctor office, go to emergency to get that checked out instead of doctor office. So very, very true. Don't go to doctor office, go to emergency. 嗱，各位堂友，點解我話要去急症室嘅原因咧？就係因為診斷你係咪有中風咧，只能夠喺醫院裏邊咧實係做幫到你嘅。第一，佢可能做個叫做 CT scan 啦，腦掃描啦。咁佢腦掃描多數醫生有冇㗎？冇啦。同埋有 MRI 亦都冇啦。超聲波可能有，但係個問題，因為你個嚴重嘅醫療嘅問題啊，你一定係去醫院先有呢啲咁嘅所有嘢幫佢哋。咁你可能要做個心電圖啊，有腦大電波問圖啊，呢啲嘢全部都要喺邊度啊？急症室做。所以變咗嚟講，一定去急症室。OK， so imagine all these diagnostic tools like CT scan, MRI, all those are in where? Emergency hospital. Is not in the doctor office. That's the reason why you have to go there to understand, are you having a stroke or you have other different issues. So diagnostic, most likely you have all these CT scan, MRI, ultrasound. Most likely the CT scan will definitely go first, or EEC will come later. But important, they will understand where to scan, MRI, to understand, you have a bleeding, you have what have you. And that is something that they definitely will do. Now, so let's talk a little about the type of stroke, okay? 咁我而家講下咧，乜嘢叫不同嘅中風啦？咁你有多啲了解乜嘢嘅不同嘅中風咧？有3大中風嘅 ，OK？ So there are actually 3 types of stroke, and the first stroke is called ischemic stroke. Now, I tell you, diabetes has most likely have this ischemic stroke. Many of the diabetic will have this stroke, okay? Or pre-diabetic also have this similar same type of ischemic stroke. So if you are pre-diabetic, diabetic, that's something that you gotta watch because 1, this is the most common stroke for also many of the stroke victims. 9 out of 10 times are in this stroke. And what happened is the blood vessel become very narrow. As you know, why become very narrow? Because remember we said earlier, your cholesterol and your sugar are gonna start forming plaque. So your vessel become blocking, and your brain, all the micro vessels are blocking with the plaques and cholesterol with sugar, and the blood cannot go through. So net result, your blood vessel become narrow and blocked and not go through. Then you know what? The brain back is gonna start dying, and that's why you have that stroke. So this ischemic stroke is the most common stroke for diabetes, and also out of the stroke, 9 out of 10 people are in this type of stroke. Plus, many of you guys have the fatty deposit, cholesterol, and sugar all get together, are blocking. And on top of that, there might be also some of the clots come from other part of the body, could be come from heart, come from other artery that comes up in here. You see this plaque that goes through here and go into this area, this narrow area. You know what? The blood cannot go through, you block, now you got an ischemic stroke. And result, you are severe reduced blood got into these vessels at the back. So all the brain cells at the back are gonna start dying off. Now, that's the reason why ischemic stroke is so important. You gotta get treated very quickly. And the time you definitely can get a treat real quick if you have the right identification, what is the issue, and also getting the right drugs. And that's the reason why I want you guys to understand this carefully so you can get treatment real quick. 嗱，一個血性嘅中風咧，係常見喺呢個糖尿病患者或者前期患病者，或者係所有大多數中風嘅人咧，90%嘅人咧都係呢個中風嘅。嗱，呢個中風咧個原因就係因為睇講咗啦，我如果糖尿病嘅我就塞得好緊要，塞咗喺個血管度加糖加膽固醇，塞咗喺個腦嘅 micro 細胞 micro 啊，即係好細嘅血管裏邊咧，就係咁塞落去咯喎。你睇呢個跌咗喺呢度，塞咗喺度咧，咁啲血就去唔到咯喎，去唔到後邊個 brain 咧，後邊個腦嘅細胞就可以死㗎啦。死咗嘅時候咧，咁你就已經開始有呢個中風嘅風險喺度。咁同埋仲有一樣嘢咧，好多時咧就可能你心臟啊、其他地方有啲血塊彈咗出嚟，亦都上咗喺度，塞咗喺度。咁呢個咧亦都係有同樣嘅情況發生。咁所以變咗嚟講咧，係喺多數咧，如果你塞咗呢咁嘅血管咧，你就會有一個缺血性嘅中風。哇！呢個真係好大問題喎。所以變咗嚟講咧，點解糖尿病者真係要好注重呢樣嘢？因為你個糖尿病好風險，個原因就係你會有好多係咁塞，咁腦個細胞咧，尤其是呢個叫微絲血管細胞就係咁塞出嚟㗎啦。OK， so ischemic stroke is one of the high incident for diabetes and also high incident for anybody. 9 out of 10 stroke are like that. Okay, so if you are in an ischemic stroke treatment, what's going to happen to you? The goal is to restore blood flow to the area. Make sure that blood, if you get stuck here, it's actually able to, like this, blood clot are being dissolved, and then you can able to get your blood flow to the back of the brain cells or wherever that vessel traveling. Now, the sad part is that's why time is so important. You only have 3 hours. You got to get the clot drugs that able to decrease, dissolve. So net result, you can very quickly get this blood to the cell. and the time is only 3 hours, my friend. That's the reason why you don't want to wait to go to the doctor's office and then transfer to the hospital. You go direct to the hospital. You eliminate all the traffic. The 3 hours is your time to have stroke. You got to be treated right away to get that drugs over. Okay? 嗱，點解頭先講咗咧？你呢個係咁重要。如果你有缺血性嘅中風咧，你一定要盡快去邊度啊？去醫院。個原因咧就係因為如果你係中風嘅話，第一樣嘢呢個咧係最重要係幫你你嘅所有目的地咧，目的啊係要將啲血能夠通得翻去個腦後邊細胞嘅血 travel 後邊個細胞嚟，一定快通到。當你有呢樣嘢嘅時候咧，你可能有用藥嚟做嘅。如果用藥嚟做嘅時候咧，你個時間係得3個鐘頭。所以點解話喂唔好去即係唔好去醫生先，然後之後去急症室，你阻晒時間，因為你嘅時間只係得3個鐘頭。所以呢個咧一有呢個情況法咧，快去咩啊？急症室。Okay? So remember, your goal is to restore the blood flow. The time is so important. You have to quickly get to where? Hospital, emergency, right away. Okay? Now, the second stroke is actually is even harder and is really, people can die from it and can be severe damage. Is your blood vessels are being weakened and suddenly your blood vessel bursts and start bleeding all over the place and leaking inside your brain. And it's so hard to stop because your brain has nowhere. If you get cut, you know what? You can stop the breathing by pressing pressure here. You can stop the breathing, correct? But when your brain, your vessels up here, you can't do this. So we'll continue to bleed until it stops by itself. Now, the sad part is depends on which vessel you have. If you have micro vessels, small little, they will stop by itself. Then your brain damage may be less. But what happens if you have a big vessel, it bled big time, then you will bleed into the brain and bleed into this area and affected your breathing. You know what? You most likely will die, okay? And that is a lot of people having this, and an issue can occur, especially some of this can be, and I explain later why some of this can happen. Because a lot of the time is you don't know which vessel you are weak, and this brain vessel is weak, and you will have sudden burst. And I will tell you some of the things that you really have to watch. Elderly, do not stress your bowel movement because you don't know where vessels is weak. So you push your bowel movement out. That is probably one of the bigger causes. And I've lost quite a few patients just because of that, because the blood vessels is burst. So this is something that is called hemorrhagic stroke. And that is hemorrhagic stroke is a big item that when it bleed into your brain and you can't stop the bleeding, and most likely you are either very bad damages to your brain, where you have tremendous disability, or you will die. So because the brain will stop bleeding by itself, not by your pressing pressure or whatever. So something that hemorrhagic stroke can be a very, very bad stroke for anybody. 嗱，各位同學，出血性嘅中風咧係一個十分危險嘅東西。因為好多時咧，當我哋譬如我流血啦，咁我係嗰隻手撳住佢會停血係咪？啲血唔會流，或者我把衫我撳住佢都唔會流啦。但係腦有唔同喎，你點撳住佢啊？佢唔識撳，佢繼續流。如果你微絲管咧，佢自己都會係慢慢會識去停流血嘅。咁但係嗰陣時咧，已經一笪地方一炸佢有好多血塊喺裏面咧，又阻住個腦嘅 function 啦。咁嗰陣時咧係有好大問題。最大嘅問題咧，如果你有個大血管爆咗之後咧，弊家伙啦，啲血咧就會流晒喺呢度裏邊啦，再流去後邊嘅時候咧，就壓住個腦嘅神經啦，氣都透唔到，終歸你點啊？因為個腦咧係只係個全部係嗰個腦裏邊咧 係有個腦嘅盤骨喺晒度咧，個腦嘅壓力越嚟越大嘅時候咧，係冇地方走喎，冇地方走嘅時候咧，咁就壓落去你啲神經咧，你連氣都吸唔到咧 ，eventually 你就會死啦。所以變咗嚟講咧，呢個係一個好難醫嘅東西，好多人有呢樣嘢咧，個即係生存機會係低好多，同埋咧，如果就算佢自己停咗流血咧，你嗰度只會慢慢好嘅時候咧，都係一段時間好長好長嘅時間嘅。咁呢個係一個最大嘅問題，所以咧喺醫治方面咧，好多時咧就會係第一，佢係要控制你咩啊？你嘅血壓啦，因為個問題咧，當你流血嘅時候，你血壓亦都會繼續好高嘅。咁好高嘅時候咧，你都繼續流血喎。咁同埋咧，最大嘅問題咧，就會個腦咧開始脹啊。咁你要脹嘅時候咧，你個頭係冇地方俾你脹嘅喎，所以變咗嚟講咧，要 end up 咧，你就個腦嘅壓力好大啦。咁同埋仲有咧，可能就 end up 咧，你要用即係手術啦，將佢蓋咗個角之後咧，係離開咗，咁然後抽血出嚟，呢個就可能一個嘅 treatment 啦。所以依家係一個好大嘅問題嘅。So hemorrhagic stroke is a very difficult treatment. The reason is because while you're bleeding, I can use my hand stop the pressure, the bleeding will stop. But on the hand, if you are in a brain, if no one can do that, so you can, the blood will continue sipping out. On top of that, when you have that kind of bleeding, you know what? Another problem will show you have always high blood pressure start out. So the blood pressure will continue to be high up there. So end up, you know what's going to happen? Your brain will continue to have bleeding because the blood pressure is high. Your brain is not going to swell. As you know, the brain is a hot matter because you have the skull, you have no place to go. So end up, your brain has no place to go. The pressure going to go bigger and bigger inside inner brain pressure. Will compress your brain to the breathing mechanism. End up, you know what? You are not going to be able to breathe and you die. Okay, so that is the kind of risk that you're going to have with this stroke. On top of that, you might end up to have a brain surgery. If you're young enough, they might actually open the brain and draw out the blood, release the pressure of the brain. On top of that, release by draining the blood out. So you might have that. But when you're older, maybe 70, 80 years old, the doctor might say you cannot survive the surgery. So they might don't want to do that. So you got to keep that in mind. This is something that extremely difficult situation. And I have lost quite a few patients in that. I saw it with my own eye, and a patient basically, especially, I have a patient who is over 89 years old. And the problem she has was she forgot to take her blood pressure pills. She is only if someone can give her the blood pressure pill, she is not going to have that problem. But her blood pressure went up to 300 because forget her pills, because it's almost a week, no pill. So blood pressure going to goes up. So when your blood pressure going to goes up, you know what's going to happen? Brain pressure also goes up. Eventually it bursts. And that result, she has tremendous blood in her brain. She finally actually cannot survive. So I have so many stories I can tell you on that, and that's why so important. Remember, if you're a blood pressure person, meaning your high blood pressure, make sure you take your pills. Make sure your blood pressure maintained below 130, over under 90, 80 something. And if you're diabetic, make sure that you continue to take a pill, and blood pressure, most like many of you, and cholesterol, so you can continue to control that. You don't want it. And later I teach you, make sure your bowel movement is smooth and easy to come out. If not, don't go, and then that is many of these patients, because of the bowel movement just squeeze of the pressure, they end up then burst one of the brain in the burst one of the vessels in the brain, and that's why they become the stroke. Okay, so the risk factor also really on hemorrhagic stroke is that one, the blood pressure is high and controlled. As I mentioned, one of my patients, the blood pressure went up to 300. okay, not 120, 300 because forgot a pill. Now, a lot of old folks have that issue, forgot blood pressure pill. Also, some of them is because they usually take blood thinners because of the heart problem or transplant problem, or they have a heart valve, they take thinner. So net result, the blood thinner will be weaken some of the vessels, and also some of the vessel here has an aneurysm, like the wall has a very thin area. When you pressure, it bursts. And also another one is trauma accident, car accident, you hit your brain, or you fall down in sport. Those are very typical. I saw many times. Now, one of the things that for diabetes and our group here had a lot of time is protein deposits, sugar deposits stuck on the vessels are very, very common, and that actually weakened the wall of the vessels. So with the high blood pressure, decreased blood flow inside, the brain continue to damage. Eventually, you have dementia also, and also it weakened the wall, it will burst, and that's where you come. And then usually, sometime when you ischemic stroke, also lead to hemorrhagic stroke. So a lot of time, all these are together because you started off only ischemic stroke, eventually hemorrhagic stroke. So this can be, again, another ongoing, get more serious stroke. That is the key that you can be very, very scary to you, okay? And so, 各位堂友嗱，記住咧，當你有出血性中風危險咧，係有好多唔同因素。頭先講咗啦，我有個堂友啊，唔係有個朋友啦，咁佢唔記得食藥，其實咧佢係一個老人家89歲啊，89歲，佢唔記得食藥，佢只係一個禮拜唔記得食藥，但係佢血壓咧去咗300，佢有血壓高嘅。咁當然有些糖尿，但係血壓高啦，重要就唔記得食藥。血壓上300嘅時候咧，就個腦爆炸，一個微絲血爆咗，咁佢個一係咁流出嚟啦。咁佢血壓繼續高咧，咁越高咧，血壓嘅時候咧就越多血流出嚟嘅。OK， 咁同埋仲有好多時咧，當你有心臟病啊，或者你自己有個有啲即係做咗手術咧，你俾個微絲血管有啲嘢捉住嗰個血管咧，咁呢啲咧就係好多時要食薄血丸啦，或者好多時有啲人都食不同嘅薄血丸啦。咁變咗嚟講，血管咧就開始有啲地方就係弱啲嘅，咁嗰度又爆啦。同埋咧，仲有咧，或者你血管本身就好多，即係呢度係唔係咁正仔嘅地方，好薄嘅，咁忽然間爆咗咧，呢個就叫 aneurysm， 呢個係好多常見呢樣嘢嘅。咁有啲人咧就汽車嘅撞車啦，或者去即係打足球啊，或者任何嘅活動咧，你撞到腦啦，咁好多時咧個腦出血咧，好多時就係呢個情況發生嘅。嗱，糖尿病者同埋前面話咩？最多就係呢個 protein 嘅 deposit 或者你糖嘅 deposit 塞住血管咧，呢個亦都係常見嘅。仲有一樣嘢好大問題咧，就好多時咧，當你頭先係有個 ischemic stroke， 係好多時咧就令到你咧會 become 一個 hemorrhagic stroke， 呢個係常見嘅東西。所以變咗嚟講咧，如果你個 stroke 係醫唔到咧，咁佢啲壓力越大咧，咁呢度就爆出嚟啦。OK， 係咁簡單嘅。所以變咗嚟講咧，如果嗰啲血管有好多 plaque 喺度咧，第一你開始唔記得嘢咧，第二咧嗰啲壓力會增大咧，會爆。所以呢個咧係all連貫性咧，所以一定要係記住咧，呢個如果爆呢個血管咧係難醫好多嘅嚇，記住啊。So keep that in mind when you have this type of stroke is extremely difficult. That's the reason why we always ask you folks to be very, very good, to be careful, make sure that you do not you got to get treatment fast, make sure you don't end up with a hemorrhagic stroke. You just make sure that it doesn't breathe freely, because when you breathe freely, the chance of survival is getting less and less. Now, the third type of stroke. Now, first one we'll talk about is ischemic stroke. The second we'll talk about hemorrhagic stroke. Now, the third type of stroke is called transition transient ischemic attack. In other words, you really have a ischemic stroke, sign and symptoms same, but only thing is it is transient, in meaning that it's short term. When you get the blood go through, right away the stroke symptom disappear, can be disappear fast and easy, but doesn't mean it's not going to come back. So you better quick treat it as a typical stroke. Go get treatment right away, identify where you're being stroke, and get treated with medication. Okay? Because this meaning stroke doesn't mean that, oh, I'm getting well, so I'm okay. It is not okay, because the chances of that coming is high. It might not give you the permanent damage right now, but eventually it can come real fast. And that time of the stroke and blocking the blood, maybe a couple minutes, maybe 5 minutes, no more than 5 minutes. But that clot and debris might be flow to the other part of the brain. So net result, you might get a stroke in a few hours later, or even a symptom that can maybe a few days later you get that. So that is something that you need to get treated right away. So if you have so-called TIA, transition ischemic attack, the chances that we go full stroke later are very high. So keep treating like a normal stroke, but get treatment right. You're lucky you have get that right now. Okay? 嗱，記住短暫性嘅腦缺血發作咧，好多時就係因為啱啱呢個塞咗喺度，咁可能啲血就翻塞咗之後就可以通得翻，咁可能係幾分鐘嘅時間。但係你個 silent symptom 係識一樣喎，反而弱咗一笪地方，咁但係你忽然間你症狀唔見翻，你就以為冇乜事啊。但係你就唔可以咁重視嘅，因為好多時咧可以呢啲咁嘅，譬如個碎塊啊、血塊啊，可以留醫到去啦，去後邊都得嘅。咁可能呢個時間咧係幾分鐘後，可能幾個鐘頭後，所以變咗嚟講咧，有呢個咧你係當好似你個 stroke 一樣，就快快去脆咧，就要去話俾你個醫生聽，快快脆脆咧去醫治你嘅東西。如果唔係咧，你係會有好多問題咧。當然啦。如果你係繼續後面忽然間又中多一次嘅時候咧，可能大件事出現嘅。咁所以變咗嚟講咧，你係要即刻又係要去醫院啦，揾醫生，揾你個急症室咧，係幫助 identify 你係咪真係短暫性啊？如果啲咧都係要 treat 嘅 ，OK？ 咁呢個 risk 係最大問題係防禦你咧，佢可能呢個 clot 會飛咗後邊咧，或者嗰陣時咧。咁你個真係 full stroke 就出現啦，咁呢個就要好小心，好小心。Okay, so now talk about how you can prevent the stroke, and we talk about now what caused you the stroke, and so we will cover this now to get you better understand why stroke will occur to you. Besides your potential diabetes, or you're diabetic, or your other factors. Now. Lifestyle is always an issue in stroke because you can be very much overweight, you're obese, you are not physically active, you will sit and then to continue to just watch TV. That can be an issue. And a lot of people also have heavy drinking. In other words, I drink a lot of whiskey every day. And on top of that, some people are use cocaine. All these can be a factor will increase the chances of a stroke. Now, 我應該講講咧，現在可以講講就係其實用有咩生活嘅方式係能夠令到你中風嘅風險咧，同埋有咩病係能夠你中風嘅風險咧？咁我講生活方式先。生活方式咧，第一樣嘢，如果你係好肥胖嘅，我係已經好重磅嘅，同埋咧我係唔喐嘅，我又唔去做運動嘅。咁我同埋咧成日飲酒嘅，飲烈酒啊，唔係啤酒啊，飲烈酒啊、威士忌嗰啲東西啦。同埋咧，我係有非法藥物嘅，好似可卡因啊，我係呢啲人咧，咁呢個咧中風嘅機會會高嘅。咁呢個記住啊，所以呢個係生活方式。但係喺 medical 方式咧，醫療方式咧個風險咧係有更加大嘅風險啦。咁呢個咧我亦都一路咁話俾你聽。So the next risk, besides we talk about the lifestyle risk, being obesity, drinking a lot. Alcohol and so forth. Now we talk about medical risk. So you guys need to remember this. The 3 high are your biggest medical risk. In other words, I'm high in what? Sugar, diabetic. I'm high in cholesterol, second high. I'm high blood pressure. Again, is the 3 high here. But one of the high, which you might not know, is obstructive sleep apnea. Okay, where you need a CPAP machine to breathe air in there, so you continue air to get oxygen up to the brain. A lot of people don't know that, but if you are obstruction sleep apnea, we are 4 times more likely to have stroke. This is a hidden thing. Nobody aware of this, because a lot of people say, I have 3 high, yeah, I remember. But obstructive sleep apnea, you might not know. So I want to make sure you guys know. So make sure if you have a big neck, you start snoring heavily, you better go get a doctor to check it out. Are you a sleep apnea? Because 4 times more likely you get stroke. Certain heart disease, you get stroke, because you have abnormal heartbeat, your blood, your heart will go irregular, you get easier to form clots, go back to the brain. You always have that. In addition to that, your family history, you might have stroke, heart attack, TIA. Also, we found that now COVID-19 infection also create ischemic stroke. Now, if you're a smoker, you also have high chance of stroke. 咁我講咗咧，其實喺醫療方面咧個風險咧，3高就係你最大嘅問題。第一，糖尿病就咩？血糖高，血糖高係塞咗你嘅血管喺個腦度啊。第二樣嘢就 high cholesterol， 你個高嘅膽固醇，高膽固醇加埋糖咩啊？塞腦啊，記唔記得？第三，血壓高，3高就係你嘅風險啦。嗱，有一個風險好多人都唔知道嘅，原來咧你睡眠窒息性咧係一個好大嘅風險嚟嘅，因為咧有4倍嘅stroke 嘅可能性，4倍嘅中風可能性啊，增加風險啊，4倍啊。個原因咧就睡眠窒息你譬如瞓覺咧，你係好大聲嘅雷公咁大聲嘅 snoring 啊。咁你如果好多時咧啲氣去唔到咧，你個氣去唔到個腦嗰度啊，咁所以咧睡眠窒息性咧，呢個係一個大風險嚟嘅。如果你係晚瞓覺嘅時候，你睇咧話你咁搞錯啊，好嘈啊你，咁你快咧就去睇醫生，睇下你係咪有睡眠窒息性。如果你有呢樣嘢方面嘅時候咧，你個中風機會係高嘅。咁當然咧，心臟病一定有啦。如果心臟病你個心係唔係泵得好 regular 嘅，有時泵下唔泵下，停下停下，好多時你就 form 啲 clot， 啲 clot 就去邊度啊？個腦嗰度啦。咁同埋你個屋企人好多有 stroke 嘅問題咧，個 chance 你有 stroke 都係高嘅，或者你有 heart attack 嘅問題咁仲有依家咧係原來咧 COVID-19 infection 亦都有呢個 Ischemic Stroke 嘅喎。咁如果你食煙，亦都有一個可能性。So all that you have to pay attention. You have to make sure you are really healthy. Make sure you treat it. This is something the medical risk is there, so you have to know. Okay. So we'll talk a little bit about prevention. So we'll talk about other high-risk stroke people are if you're age 55 and older. So if you are if you are 55 over, the risk is going to be higher because you are age. Most likely you have people that you have diabetes, all kind of other health problems. So you really need to check versus the young guy, okay? Doesn't mean the young don't have, but you are higher risk because you're old. Secondly, you are African-American, higher risk. If you're obese, are higher risk. And sex, men are higher risk than women. There are more men on stroke than women. Now, older women usually have stroke more than men. If they're older women, and usually in the study show that older women, if they're stroke, they tend to die more than men. So that's something that we have to also watch. Second is the hormone. If you have birth control pills all the time, your hormone also have been out of whack. including estrogen usage, is also have high chances for stroke to create stroke victim. So these are the kind of other factor you need to think about. Now, 朋友，因為如果你係55歲以上咧，你係高個風險啲後生嗰邊嘅，同埋雖然咧呢度就冇咁多係黑人啦、非洲人種啦，佢亦都係高風險嘅。但係男人咧係多 stroke 過女人嘅。但係女人嘅時候，如果佢有 stroke 係老一輩咧，即係80歲啊以上嗰啲咧，就多數係嚴重嘅stroke 嘅，即係嚴重嘅中風嘅。咁多數好多女士咧，因為咁嘅嚴重咧就死亡嘅。咁仲有好多係因為佢係用咗避孕丸啦，同埋佢個荷爾蒙嘅荷爾蒙嘅醫療方法啦，咁令到咧佢係有好多不同嘅荷爾蒙不平衡啊，咁亦都增加咗中風嘅風險嘅。咁呢啲就其他嘅中風嘅因素啦。咁其實咧，我依家要講下點解預防中風啦。Now we are talking about the 3 stroke. We talk about if you have stroke, you have to go to hospital right away. Don't wait. And now we talk about how do you prevent the stroke? How are you going to prevent it? Because can you prevent? Yes, you can prevent. Definitely you can. Now, first of all, very important in prevent stroke is really come from what? Dieting. Because if you don't eat a lot of high-fat diet, a lot of cholesterol, control your diabetes, you know what? Chances for you with stroke is much, much lower, you know? On top of that, if you don't take a lot of high-salt diet, where your blood pressure going high, again, the chances of your stroke is going to much more lower. So diet become a very important factor to become your stroke prevention. Now, certainly, you got to do something is what we are just talking about all the time. You got to eat plenty of vegetable. You got to eat plenty of whole grain. You have to eat fish, less red meat because red meat is, less cholesterol. You eat a lot of fruit. So lower your blood sugar. And drink Lowsutea definitely is the key because you drink Lowsutea, you lower your blood sugar, you lower your cholesterol, you lower your salt. So you basically lower blood pressure. Then in turn, you lower your risk of stroke. You have to change your lifestyle, meaning that you have to have a very good healthy habit. You have to diet, you have to exercise, lower your weight, the tummy weight, and you got to take your medication. Don't forget to take your medication, like blood pressure medication, the diabetic medication. All that become a very key. Now, one of the things that I talk about, a lot of people don't even remember, is obstructive sleep apnea. If you have that, you need a continuous positive pressure going to your airway system, nutrient your brain. You have to use a CPAP machine. If you don't have that, or you don't identify that, the chance of stroke is 4 times more. So that is something that if you have snoring big time, at nighttime, and over here you are very chubby and fat, chances for you have apnea is very high. A lot of people don't know that. This is the time to identify and go for it, okay? And then one of the things that also people don't recognize is your bowel movement has to be easy to go. You don't have to go press. If you do that, you might have a chance of stroke because your vessel, when you go inside, blood pressure suddenly go up very, very high. And unfortunately, whether your vessel's wall is weak, it bursts. And then you have what? A stroke in your brain. Something like that, a lot of people don't know, but I tell you, it happened all the time. I see it all my time. I see it in my own eye when I'm an ICU nurse. A lot of elderly, the reason why they went stroke is because they did not go to have good bowel movement. So make sure you have good laxative, fibers, whole fruit vegetable to make sure you don't have to force your bowel movement. 嗱，各位朋友，預防中風咧好簡單，其實咧你開始現在就可以做到噶啦。第一，要唔好食咁多肥嘅東西啦， 膽固醇降低啦，因為肥咧全部係幫助你咩啊？塞住啲血管啊，同埋你食好高鹽嘅食物咧，又係會差點㗎，增加你血壓啦。咁所以變咗嚟講咧，其實咧你一定要食，好似我不嬲講開嘅東西，就係咩啊？要食好多，要食好多蔬菜類嘅東西，穀物葉嘅東西，魚唔係紅肉喎，魚，因為紅肉好多 cholesterol 嘅，生果、水果，即係我不嬲講嘅東西都係一樣要做。咁當然飲虛糖茶好有幫助嘅，因為幫助降低你血糖啦，降低你膽固醇啦，亦都降低你鹽啦。咁呢啲嘢咧係降低鹽啫嘛，係降低你嘅呢個血壓啦。咁變咗你個 stroke 嘅機會咩啊？降低咗咯。咁同埋仲有啦，你本身嘅生活習慣全部要改變喎，要做 exercise 啦，要運動啦，要降低你磅數啦，唔好有大肚墩啦。仲有食嘅嘢要低碳水化合物啦，同埋 cholesterol 要控制啦，要唔好食煙啦。有一樣嘢咧係睡眠窒息症咧，好多人都唔了解嘅。原來唔知道，原來你瞓覺，哇，好大聲嘅，個 snoring 好響嘅。咁呢個咧就係好多時好多人咧就知道咧，你係未因為可能因為有個睡眠窒息症，呢度啲氣咧係塞住晒，唔係你個呢度太肥胖塞住咗咧，你氣上唔到腦度咧，咁你就有呢個即係有呢個風險咧，係俾到你咧係有呢個中風風險嘅。仲有一個好嘅中風風險係唔知道咧，原來你大便要一定順暢。如果你大便唔順暢嘅話咧，你谷呢個爆血管咧機會高，因為你老人家你點鬼知你個腦裏邊有邊條血管係弱㗎？一谷嘅時候，嘣爆炸，咁啊弊家伙啦。所以咧喺呢方面嘅話咧，你一定要真係了解自己，要更加努力去做好嘅生活習慣，食嘅嘢好，要多 fibre 嘅好，要做 exercise， 呢啲嘢全部要做晒。好我不嬲講開書籍嘅咧，係同樣嘅做法。咁你糖亦都會降低，咁你嘅三高亦都會降低。哇！你嘅身體健康啦。所以記住呢個頭先我所預防中風呢啲嘅重要點啦。So today, sorry about we took a little longer time to discuss, but I thought the topic is so important. You really have to have, when you consistently high blood sugar, the chance of your stroke is high. As you remember, stroke is a medical emergency. The longer you wait, the longer brain damage, complication can occur, and you gotta go to where? Very quickly, you have to go to hospital, not go to doctor office and get treated. So that is something that you have to do quickly. And you have to make sure, see the three things always can identify whether you're a stroke or not, which is the face, where you drool one side, face muscles come down, your arm make sure it's equal, or you raise the arm up when you start dropping down. Speech becomes slur, cannot speak properly, even a short statement, you cannot say it. So these are the signs, symptoms that you have to check. Once you see that, go to treatment right away. Treatment usually by CT scan, MRI, ultrasound, all these guys in the hospital, not really in the doctor office. And the three stroke are: one, ischemic stroke, which is blood cannot travel beyond the area of a plug-in. Hemorrhagic is meaning the blood vessels in the brain start leaking, blood coming out, or one of them bursts. Is extremely difficult to treat, and most likely you will have to decrease the blood pressure to control, and that is going to be hard to do. And then third is you're going to have a transition one, transient one. Transient is usually ischemic stroke, which in turns you have to treat it like a regular stroke and then immediately go for treatment so it won't become a major stroke. And then the change of lifestyle, and you're going to really have a lot of lifestyle strain, meaning that you have to exercise, you have to eat a proper dieting, low carb diet, control your blood sugar, eat a lot of vegetable, whole grain, fish, less meat, fruits. Those are all essential for a diet. And you have to exercise. You have to lower your weight. You have to continue to take importantly, take your medication. Don't forget your blood pressure medication. And don't forget your diabetic medication if you have diabetes and cholesterol medication. So all that will work, help you to prevent stroke. And last but not least, you got to stop smoking. Okay? So this is my webinar. And let me speak in Chinese at a summary first so that we can answer any question. Okay? 嗱，各位朋友，記住，如果你係中風嘅話，你一定要快脆去邊度啊？急症室，唔係醫生嗰度啊，急症室。因為咧，如果任何嘅中風咧，你去到急症室，啲血去唔翻嗰腦後邊嘅細胞咧，咁個細胞就會死。死咗之後咧，你就第時咧行唔到啊，工作做唔到啊，呢個好大嘅破壞。咁3樣嘢記住，第一，面咧忽然間會跌咗嚟呢邊，咁或者流口水，咁變咗嚟講，你知道呢個有問題啦。第二隻手，哇揸落去咧，一隻手軟嘅，一隻手硬，一個好有力嘅，呢個亦都睇到啦。或者第二個手，一隻手慢慢 drop 嚟，亦都知道係有問題啦。咁講嘢嘅時候，你講好簡單嘅嘢，佢都講唔到嘅，佢説話嗰陣時候開始slur， 咁你就知道佢亦都有問題啦。呢啲咧即刻要去揾救護車咧送你去醫院去救治嘅。去到醫院咧，多數要做3樣嘢，唔係做3樣，多數會用個 CT scan 啊、MRI 啊，或者ultrasound 啊，呢啲係幫助佢 identify 個腦嗰度咧係邊度係出血。咁同埋咧一定會咁睇㗎啦，因為如果係出血之後，佢先知道點醫嘅。咁3種嘅腦出血嘅中風咧，第一種就係血性嘅中風啦，即係 Ischemic Stroke 啦。咁啲血咧係去唔到，呢度塞咗，去唔到後邊。第二個嘅中風咧就係出血性嘅中風，呢個就係 Hemorrhagic Stroke。如果出血嘅中風咧係好難醫嘅，個原因就係好多時咧你撳唔到啊個腦喺上面，咁好多時你就控制血壓，或者要開刀drain 嗰啲血出嚟，或者係點去呢個撳住個血管。咁呢啲嘢係如果老人家咧就係難啲㗎啦，因為多數醫生唔會話，哇你80幾歲咯，點同你仲開刀個腦咧？咁呢個咧係即係會係一個好大嘅醫療嘅問題嘅。咁當然啦，有一個叫做 transition 嘅，即係呢個好即係忽然間，但係咧好彩呢啲血管就啱啱走得到去後邊都即係塞咗啲咁多時間就走得到咧。臨時性，但係呢個臨時性唔好諗住臨時性喎，臨時性可能會係好快咧就去到一個永遠性嘅，因為個 clot 或者呢個血塊會走咗後邊，然後你個 stroke 就出現啦。咁呢個咧就係好有3樣嘢咧係一定你要小心嘅。咁仲有啦，就係點能夠咧prevent 呢個 lifestyle 嘅 change 咧即係能夠將你個生活習慣咧。係改變佢能夠 prevent 嘅 stroke 咧。For example 啦，如果我係肥胖或者我係重磅我係食飲酒呢啲全部戒啦。咁但係原來食嘢方面咧係好重要嘅。你千祈要食多，千祈要食多菜穀類嘅嘢魚生果唔係食好多紅肉嗰啲東西。同埋咧，仲有咧，你飲血糖茶當然幫手啦，因為血糖茶幫住你降低血糖啦。降低你嘅膽固醇啦，亦都降低鹽啊。咁鹽之後降低就降低你血壓，咁幾正係咪？咁呢個 stroke 嘅機會就降低啦。咁有一樣嘢好重要咧，就係你真係要 exercise 啦，要運動啦。就我講過要減磅啦，同埋咧就係即係個生活習慣要改變，好重要。記住食藥。當你食藥咗之後咧，好多時咧啲老人家唔記得成日就血壓上去，或者 cholesterol 上去。咁個 stroke 機會咧就自己因為冇藥物嘅控制咧，就令個風險大好多。咁當然啦，唔好食煙好重要啊。咁仲有一樣提一提咧，大便同埋呢個睡眠窒息性係一個重要點喺度嘅。 呢個你一定要好快去，即係用醫生係咪俾藥你食，去能夠大便通暢啊？你又唔會壓落去呢個用谷你個大便嘅時候咧，令佢血壓高啦。So this is a summary today. I want to make sure that remember that one thing, make sure that if you are snoring or not, you might need a CPAP machine to help you to breathe, and make sure that you got to see a doctor to check whether you have, you require a CPAP machine to help you to breathe, to allow air go in rather than you continue to have missing breathing of your problem. Secondly is make sure your bowel movement are well lubricated, so you do not forcing your bowel to come out and then increase the blood pressure. So I hope that I give you a good heads up on what is stroke, and hope that you can actually help yourself, your relative, your loved one, your friends. Since we're all getting old, the stroke is high because age 55 above is getting more and more and more. When you get to old 80 is getting more. So all these are potential issue. So I was wondering, anybody have any questions? And so I can answer the question. So how does a CPAP machine ensure not to have a stroke? Okay, the problem is, let me get to this page here. The problem is when you have obstructive sleep apnea, okay? When you have sleep apnea, your big, here has a lot of fat, and your tongue also comes down, depressing the air going to your lung. So net result of that, when you have left no air going to your lung, you are suffocating with oxygen going to your brain also. So net result, you are similar to like you are blocking blood vessels with O2 to the brain. So it's a similar principle. So what we do is we put a CPAP, which is a positive air machine. Nowadays it comes into a small little unit, and force air into breathing. So allow you continue to get oxygen to your brain. So net result, the chance of stroke, they become lessened. Okay, so we have I forgot in Hong Kong actually, for people who I forgot the number, but it's very high. It's 80% who are obese people. 80% of the obese people, meaning they are BMI 30 and above, they have more likely will have an obstructive sleep apnea. Wow, that's a high number, because the reason is they are very chubby, they're fat neck here, they snore highly, they snore real high, and suddenly notice they stop breathing, and they stop. And that's the reason when they stop is the air doesn't go to the brain anymore. So you end up, you have the similar issue is like the blood doesn't go to the brain. So this is where the cost. So net result, we continue give you good air flow through a machine called CPAP. So net result, you are continue to get breathing air, positive air in there. So you always get good air. Now, people who have getting CPAP, actually they become more alert during the day. They don't get tired. They are much more healthier individual. And if they don't have CPAP, they at daytime they fall asleep. The reason is because they lack of oxygen during nighttime. So I saw a lot of people have that issue. If they are 50 and 55 and above, all the time they kind of get dozed up in the day. They're really tired. They might be a person who have a obstructive sleep apnea, which need to have a doctor to check, have a sleep apnea test. At night, see we have any, they actually have a night to view you and see what you're doing. They put all kind of wire in your brain to check you whether you have, you actually have a sleep apnea. So that is what it is. So those are very good questions, Eugene. I appreciate you ask that question. 各位堂友，嗱記住咧，因為好多我哋都堂友係好大好肥嘅，係咪？ 如果你個 BMI 30%以上咧，我記得個數字咧係55歲同80歲30以上嘅人咧，好多呢啲咁嘅人咧都有個叫做睡眠窒息病嘅。咁睡眠窒息病咧個問題咧就係佢冇缺氧去個腦度啊。咁你好似係塞咗一樣，好似塞咗個血管咁啦。咁變咗咧，你冇氧嘅時候咧，你個機會中風係高嘅。咁同埋咧，好多人你知啦，尤其是瞓覺個 snoring 好大，咁聲咧，我哋除非間室咧，因為冇聲嘅，咁個人咧可能就係因為缺氧。咁所以變咗呢個咧睡眠窒息症咧，就真係要俾醫生快去睇啦。咁呢個 CPAP 嘅 machine 係做咩嘅咧？佢俾啲 positive pressure 你入去個氣管嗰度，日日瞓住個覺嘅時候咧，你有個氣面罩咧你個面嗰度咧係 keep 一啲氧俾你嘅。咁你變咗嚟講咧，你就唔會忽然間冇氧氣啦。咁佢就其實做咗呢樣嘢。咁好多人咧，因為個睡眠窒息症咧係令到自己你唔知幾時噶嘛。同埋再加你有血壓高啊，咁啊增加咗好多嘢出嚟咧，就變咗你有血管呢個中風嘅危險啦。所以變咗嚟講，呢個咧就係一樣嘢要睇睇。咁仲有一個咧，記住啊，就係去大便咧要順暢啊。OK， so are there any other question? I hope I answer all your question. Thank you very much. Okay, oh good. Thank you very much, Gordon. I appreciate you enjoy your webinar. I think this is really good. The reason I took the time to explain, I'm sorry it took you a little extra time. The reason is because many friends I saw, they actually have stroke, did not know. And I saw many patients also, they didn't know. If they actually gone there earlier, just only 1 hour earlier, the damage are not that great. And with not that great, they can recover much faster. If they are further delay, oh man, it's so sad because they suffer tremendously. So that's why I thought you got to know about what is stroke. Hopefully that will help you. 嗱，各位朋友，其實今日講嘅嘢咧，係對你屋企人、對你嘅朋友好大幫助。個原因咧就係因為我見到好多我嘅朋友啦，或者我病人咧，近時喺 IC 做嘅，即係佢入嚟咧，如果1個鐘頭少咗，即係少咗1個鐘頭嘅。即係早咗1個鐘頭入嚟咧，咁佢個可能痊癒咧係全部唔同噶啦已經，但係冇咧，哇弊家伙啦！佢個即係 suffering 係好高好高，同埋佢個病咧係嚴重好多。咁記住，即係頭先講呢啲咧，我哋一定要係真係希望你哋將你自己嘅生活習慣改變啦，同埋咧係能夠令到你知道早啲有 stroke 嘅時候即刻去醫院。Okay, thank you very much. I really appreciate your time. I know you guys are all busy. And I thank you, many of my Hawaii friends. Really appreciate the webinar. Today we have so many people from Philippines, from Hong Kong, from Hawaii, from United States, from California, from Vancouver, and also our Hong Kong friends. I thank you very much for your busy Saturday and listen to the webinar. I appreciate that. Thank you again and have a very, very nice weekend. Thank you again. Take care. Bye-bye. Thank you.